Document all findings, both normal and abnormal, in the patient's clinical record. The VELscope VX oral lesion form, tracking chart, and other useful documents are available online at VELscope.com. Re-examine any suspicious regions under white light as follows. Re-evaluate the region under white light. Re-palpate the region. Identify any conditions that may have caused the region to appear dark under VELscope VX examination. Some conditions that may appear dark under VELscope include traumatic lesions such as chronic irritation from denture friction or cheek biting, pigmented lesions such as melanotic macule, common infections such as oral candidiasis and recurrent herpes, and inflammatory conditions such as aphthous ulcers, or vascular lesions such as varicosities, hematoma, or petechiae secondary to trauma. If after re-examination the cause of the lesion cannot be identified, observe the suspicious tissue through the VELscope handpiece while applying diascopic pressure. This is often referred to as blanching. Compress the lesion using a light amount of pressure in a sweeping motion with the back side of an explorer, dental mirror, flat instrument, or your finger. Fluorescence is typically lost in areas of inflammation. If fluorescence returns when you compress the tissue, there may be an inflammatory component to the lesion. It's important to note, however, that dysplasia can also be accompanied by inflammation. If a lesion does not completely blanch when compressed, heightened observation and follow-up is warranted. For a comprehensive discussion of tissue under diascopic pressure, please refer to the training materials provided with your system. If a suspicious area cannot be ruled out as a normal variant or otherwise benign, a follow-up visit for re-evaluation should be scheduled in approximately 2 weeks. The dentist should remove all potential etiological contributors in the area, such as trauma or infection. The intervention could be as simple as relieving a pressure point under a denture base, recontouring a sharp cusp, or treating for oral candidiasis. If the lesion has not resolved after the follow-up time, proceed with further investigation of the suspicious tissue according to your regular protocol, which may include biopsy or referral to a specialist. Your clinical judgment will ultimately determine the appropriate course of action. Persistent abnormal findings should never be ignored, and should be followed until they either resolve or their cause is well understood. Emphasize to the patient, however, that persistent abnormal findings do not necessarily indicate cancer. If the patient cannot make a follow-up appointment, or if the dentist feels that the patient is unreliable, immediate steps are advised, including immediate biopsy if possible, or referral to their primary care provider or a specialist. Remember, the gold standard for diagnosing precancerous and cancerous lesions in the soft tissues of the oral cavity is surgical biopsy. A biopsy that returns a result of dysplasia or any other pathology is a valuable finding, not a false positive. Discovering dysplasia early allows for the highest probability of a favorable treatment outcome.